procedure, the first thing we have to do is to assess the wound and the tissue around it, the character and the amount of drainage if there are, the chief complaints at the wound site, and any signs of infection. Next is to assemble the equipment we will be using. Personal protective equipment, clean gloves, sterile dressing, gauze pad, medical tape, bandage scissors, syringe, hydrogen peroxide, betadine, saline water, cotton balls, antimicrobial cream, forceps if needed, and new buzzer, or moisture-proof bag. For the procedure, introduce yourself to the client, verify client's identity, explain the procedures and why it is necessary, perform hand hygiene, and of course, promote patient's privacy.
So the first procedure is remove any moist outer dressings that cover the wound. And now, put on clean gloves. Remove the outer dressing and observe any drainage on the dressing. Hold the dressing so that the client does not see the drainage. Determine the amount of the drainage and discard the dressing in the moisture-proof bag. Handle it carefully so that the dressing does not touch the outside of the bag. Remove gloves and dispose them properly. Next procedure is open the sterile dressing set using sterile technique. For assessing the wound, put on sterile gloves or may use pick-up forceps. Assess the appearance of the tissues in and around the wound and the drainage. For the next procedure, clean and dress the wound. Use gauze swab or cotton balls. Clean the wound with normal saline or hydrogen peroxide until all exudate has been removed. After cleansing, apply betadine and antimicrobial cream or ointment. Lastly, apply sterile gauze pad to the wound and secure it with surgical tape. And now, remove and discard the sterile gloves and perform hand hygiene.
Lastly is to document the date and time, the appearance of the wound, the color, consistency, the odor, and any amount of the wound or drainage, and lastly, any discomfort the clients have been experienced during the